Today I'm going to be breaking down depression as well as possible steps to overcome it. Depression is a serious mental health condition, more than just sadness. It results from a combination of biological, psychological, and social factors. These factors significantly affect a person's thoughts, feelings, and behaviors. Understanding these complexities is essential for recovery. Depression can manifest in various forms. These include major depressive disorder, dysthymia, also known as persistent depressive disorder, bipolar depression, and seasonal affective disorder. Each of these forms has unique characteristics. Common symptoms span a range of experiences. People may experience persistent sadness, loss of interest in hobbies, and changes in appetite or sleep. Fatigue, feelings of worthlessness, and difficulty concentrating are also frequent. Some people will also struggle with recurrent thoughts of death or suicide. These symptoms vary in severity. Regardless of intensity, they can significantly impair daily functioning and quality of life. The development of depression is complex, involving multiple contributing factors. First, you have biological factors. These might include genetic predisposition, imbalances in neurotransmitters like serotonin, norepinephrine, and dopamine, and abnormalities in brain structure and function. Then you have psychological factors, which also play a role in depressive episodes. For example, negative thought patterns, learned helplessness, and trauma can worsen or initiate these episodes. Social factors like stressful life events, social isolation, and lack of support also contribute to depression risk. Due to the complex interplay of these factors, depression can be difficult to treat. For this reason, most effective interventions use a multifaceted approach. Overcoming depression. There is no single cure for depression. However, combining research-backed strategies is key to improving symptoms and achieving lasting well-being. The first step involves getting professional help. This includes therapy. Psychotherapy is highly effective in treating depression. Cognitive behavioral therapy and interpersonal therapy are particularly beneficial. CBT helps individuals recognize and change negative thought patterns and develop coping skills. IPT focuses on improving relationships and managing social stressors. Medications. Neurotransmitter imbalances can be addressed with antidepressant medications such as selective serotonin reuptake inhibitors and serotonin norepinephrine reuptake inhibitors. But it is imperative to collaborate with a psychiatrist to determine the right medication and dosage. Combined approaches. The most effective treatments usually involve a combination of both therapy and medication. The second step to improving depression involves lifestyle changes, such as regular exercise. Physical activity boosts mood through the release of endorphins. Aim for at least 30 minutes of moderate exercise almost every day. Healthy diet. Eating a diet rich in fruits, vegetables, and whole grains enhances your health and well-being. To maximize these benefits, minimize your consumption of processed foods, sugary drinks, and large amounts of caffeine. Adequate sleep. It is recommended to get 7 to 9 hours of quality sleep every night. So set a regular sleep schedule and create a relaxing bedtime routine. Stress management. To reduce stress, practice techniques like mindfulness meditation, deep breathing exercises, or yoga. Sunlight exposure. Natural sunlight can be beneficial for improving mood. This is particularly true for people experiencing seasonal affective disorder. The third step involves building a support system. This includes social connection. Build and nurture relationships with family and friends. Social engagement is key. By doing so, you gain vital social support. This support brings a sense of belonging and alleviates feelings of isolation. Support groups. Joining a support group creates a safe environment. It allows you to share your experiences and find connection with those who truly understand you. Open communication. Talk to people you can trust about your feelings and experiences. The fourth step involves cognitive and behavioral strategies. This includes challenging negative thoughts. Begin by identifying the negative thoughts that arise. Challenge the accuracy of those thoughts. Shift your mindset by replacing them with positive and realistic perspectives. Setting realistic goals to tackle big projects. Create smaller, achievable tasks. Engaging in enjoyable activities. Prioritize activities that bring you joy and pleasure. Practicing self-compassion. Be kind and understanding to yourself. Understand that depression is a mental health condition, not a reflection of your character. Mindfulness. Through mindfulness, people can observe their thoughts neutrally. This practice also promotes a sense of presence in the current moment. The fifth step involves long-term maintenance. This includes relapse prevention. For long-term well-being, continue using healthy habits and coping strategies. Don't stop just because you feel better. Regular check-ins. Consistent appointments with your therapist or psychiatrist are essential. They enable progress monitoring and ensure your treatment plan remains effective. Continued learning. Learn about depression and find all available treatment options. Remember, recovering from depression is a journey. You may experience setbacks. These setbacks do not mean you have failed. With patience, consistent effort, and self-care, you can overcome depression and improve your life. If you or someone you know is struggling, please seek professional assistance. Getting help early can make a significant difference.